Good afternoon, and thank you all for joining our digital event entitled Paid Leave, Livable Wage, Affordable Care, Policies that Could Avert the Next Crisis. My name is Devon Bodie, and for the past year now, I've been working on the issue of care and looking into its impacts on financial security and really just our daily lives. So before I jump in and talk a little bit about our panelists, I just wanted to say a few words about the state of the world right now. I'm going to be honest, I struggled with what to say today, but I'm so thankful to have this platform to talk about an issue that is very close to my heart and a lot of yours as well. All within 3 months, we have lost over 100,000 lives as a result of coronavirus. Many of them have been disproportionately Black lives and Brown lives. But in addition to that, for a long time, we faced a state of racial violence against the Black community. The murders of George Floyd and Breonna Taylor have catalyzed protests across the country and around the globe. And this is really just a tough time. But I truly believe that it requires us to be both focused and committed to the work of achieving racial and gender justice. And mostly because these aren't just videos, these aren't just numbers, these aren't just statistics, these are our lives, these are Black lives. So although we face continued threats to our humanity, to our health and economic security, I am hopeful that this crisis will catalyze changes to help us create an economy and a society that is free, just, and equitable. And together we will get through this. So today we have an amazing set of dedicated speakers joining us. Our first conversation will be with Dominique Durbiny of Closing the Women's Wealth Gap and Ai-jen Poo of the National Domestic Workers Alliance. Their conversation will explore the value of caregiving to our society and economy, and then take a deeper look into caregiving as a profession and the intersections of gender and race. After that, we will be joined by Shauna Bartley of the National Women's Law Center, Jamie Calmarides of Prudential, and then Julie Cashin of the Century Foundation for a cross-sector discussion on just the range of family care needs and short-term and long-term solutions and responses. And excitingly, this event also serves as an introduction to our inaugural research report titled The Cost of Caregiving. This report really just explores why an equitable care system for children, for adults, and for elders is essential to household financial security. So this past year, the Financial Security Program identified the cost of care as an emerging financial security challenge and one that affects us all. This report illustrates care through 4 pillars, those being childcare, adult and elder care, family caregiving, and professional caregiving. And we find that a successful care system must work across each of these sectors. A holistic approach is necessary for families and care workers alike to earn income, accumulate assets, and save for the future. So this report goes into detail about design principles and promising examples that could achieve a truly equitable care system. We invite you to download the report today and share key findings, many of which impact you and your work. And I will now go through just a couple of the key findings, but there's so much more in the report, so I encourage you all to read. From infants to adults to elders, every household is likely to need care support or caregiving at some point in time. Our care system includes an extensive community of people who both need care and people who provide care both informally and professionally. And leading up to COVID-19, 53 million people, about 1 in 5 in America, incurred expenses related to caregiving. Both the cost of childcare and the cost of direct care for older adults and adults living with disabilities poses a very hefty financial burden on families and individuals, and these costs have been rising for the past 10 years now. In some states, the typical cost to purchase these caregiving services can easily exceed 30% of a family's income, and that is in addition to other expenses that a household may incur, such as housing, healthcare, education, and debt payments. I'll now go into a little bit about caregiving, professional caregiving. So caregiving has a history that is inseparable from racial and gender dynamics. Women were and continue to be prominent in caregiving roles, especially those involving childcare and domestic work. These functions have historically been underpaid, undervalued, and disproportionately made up by Black, Latina, and immigrant women. And today, professional caregivers are among the lowest paid workers in the nation, and some do not have access to labor protections and workplace benefits. As you see here, approximately half of professional caregivers rely on some form of public assistance to meet their basic needs. So overall, experts agree that a lack of family policies amid rising care costs creates a system that really just relies on an underpaid workforce and one that forces families to shoulder most of the cost burden. So how can we reimagine a world where care is treated as a public good? Because we all reap the benefits of better care for our children, our elderly, and for people with disabilities. How do we quantify the benefits of family care, like different policies like paid leave, livable wages, and affordable care? And lastly, what are we seeing as feasible short-term policy responses during COVID-19 crisis? And how do we turn those into longer-term gains to build a better system of caregiving across the US? Our event today will explore each of these questions and more. And lastly, our work on this issue has been made possible with the amazing support of Citi, and we are thankful for their partnership. And with that said, I'd like to invite Dominique and Aijen to turn on their cameras for our first conversation.
Great, thank you so much, Devon, and thank you for having us today. I really appreciate you starting us off and just anchoring in the moment that we're in right now. I, like you, have been, just having a difficult time and was struggling a little bit with how I wanted to show up in this conversation. But at the end of the day, all of these issues are interconnected, and at the root is the need for racial justice. And so I feel like that's my commitment, and definitely wanted to show up in this space, in this conversation with Aijen. So for those of you who don't know me, I'm Dominique Durbiny. I'm Deputy Director of Closing the Women's Wealth Gap. We are a national initiative and network focused on economic equity and creating pathways to lasting economic security and dignity for women of color, women who are paid low incomes, and other women who are marginalized. And I'm here today with Aijen Poo. Aijen, you're a well-known labor organizer, a leading voice in the women's movement, and a fierce advocate of domestic workers. You're currently the Executive Director of National Domestic Workers Alliance, co-director of Caring Across Generations, and recently co-founded the group Supermajority to train and mobilize a multiracial, intergenerational movement focused on gender equity. So I'm really grateful to be here with you today for this conversation. As you know, this conversation is focused on making the case for a care revolution, but as Devon mentioned, there's sort of this larger revolution that's brewing outside right now, one that is focused on addressing the persistent and relentless racial terror and state violence against Black bodies, a battle that we've been fighting for centuries. So as I mentioned, it's been a little difficult to pivot to focusing specifically on the needs of a care system when right now people are protesting for the right to simply live safely in a Black body. It's sort of like Maslow's hierarchy of needs, where at that most fundamental level, is safety and humanity. And then if we achieve those things, we can work our way up to things like economic security and an equitable care economy. And both of these issues do, though, share that core thread related to sort of how we see a hierarchy of human value in this country and the ways that we have undervalued Black and brown people and women. And so when we sort of think about the care system, including those different roles that Devon mentioned, family caregivers and professional caregivers, both of which are roles disproportionately filled by women and women of color, it makes me think a bit about the history of care in this country. And we know that enslaved Black women were forced to provide care for and to nurse the children of their enslavers. And then following emancipation, caregiving and domestic work were one of the few employment options that were available to Black women and women of color, as particularly women who are immigrants. So talk to me a little bit about, the role of this history in the inequity and the undervaluing of care work.
Thanks, Dominique. I just wanted to start by acknowledging and just recognizing the incredible strength and leadership required of Black women leaders right now, and to thank you for showing up and leading, as well as Devon. It is so important and we're so grateful. And just to acknowledge the incredible devastation of this moment for Black caregivers all over the country as we continue to navigate this pandemic, which has disproportionately stolen Black lives, Black livelihoods, on top of an epidemic of police and vigilante violence that has been stealing Black lives for generations. It is just an incredibly painful and difficult moment for Black caregivers all over this country and Black families. And I just want to begin by acknowledging that and understand that that has to be at the center of how we talk about caregiving solutions as we move forward. And that is the choice that is before us in this conversation and in all of this advocacy for the care economy that we deserve in this country. The experiences of Black families are what need to guide the way. And that has its roots in history, as you pointed out. The National Domestic Workers Alliance builds upon a long tradition of Black women's organizing, starting from 1881, when the first Black domestic workers went on strike in Atlanta. And then in the 1970s, when Dorothy Bolden formed the National Domestic Workers Union, it was courageous Black women who work in the care economy asserting the incredible value and dignity of care work and the importance of supporting caregivers for everyone. And it has been a long and hard journey. You mentioned the first professional caregivers in this country actually were not professionals, they were enslaved Black women. And that ever since then, it has always been women of color, Black women, women of color, immigrant women, women of marginalized social status that have done this work. And the marginalization and devaluing of this work has really been written into our laws time and time again. In the 1930s, when Congress was in the midst of the New Deal, discussions about what kind of labor laws and protections we needed to put into place, Southern members of Congress refused to support the National Labor Relations Act, which gave workers the right to form a union and collectively bargain, and the Fair Labor Standards Act, which established the minimum wage if they included protections for domestic workers and farm workers who were Black workers at the time. So in a concession to those members of Congress, the core pillars of our nation's labor laws, the framework for how we protect workers' safety and rights in this country, were on the backs of excluding Black workers. And it's in the shadow of that racial exclusion that the experience of care workers has unfolded for decades. And to this day, this work of caregiving is still associated with women, whether it's family caregivers or professional caregivers. And as professionals, it's still associated with women of color. And it's still disproportionately women of color. And we still value home care, for example, at $16,000 per year. The people, the professionals we rely upon to take care of the people who raised us, my grandmother, my mother, and our loved ones with disabilities, some of the most important people in our lives, are paid less than poverty wages and cannot take care of their own families doing this work as professionals. And that is what we must transform. And I think that is what this paper, this research, and a whole set of us as advocates are trying to set the stage for. Coming out of this crisis, how do we transform, reimagine, and reinvest in our care economy in a way that addresses all of these historic structural ways that we've devalued care work and put us on a path to a caring economy, one that we've always deserved, all of us.
Absolutely. Thank you so much for sharing, a bit more about really the exclusion of Black and Brown women in these policies, the devaluing of them in these laws, and the importance of putting Black women at the center as we think through what this future care economy looks like. In this current moment with COVID-19, we're seeing a lot of implications for care and domestic workers. And as Devon mentioned, and as you mentioned, Black, Latinx, and other women of color and women who are immigrants are overrepresented in these professions where they're providing care, and now they're being deemed as essential workers, but they're not actually being paid, living wages. They don't have access to benefits like health insurance and paid leave, right, to take time off if they're ill. They were largely excluded from those benefits, the paid leave provisions that were enacted in the legislation recently. And on top of that, there's a decreased availability of their work. I read in a report from National Women's Law Center that 350,000 childcare providers have lost their jobs in the past 2 months. So in what ways in this moment has the current pandemic really exacerbated and exposed the vulnerability of women of color who are care and domestic workers in the overall profession?
It's such an important question. I mean, this has been a crisis of impossible choices for care and domestic workers. On the one hand, we saw very early on that domestic workers were among the first to lose their income and lose jobs. And we were hearing from nannies that they were getting laid off and had no idea if there would be a job on the other side of this, and were worried early in March if they were going to be able to put food on the table. And then on the other hand, you have a set of workers who've continued to work through this crisis, providing essential services. You have home care workers who are in many cases the only lifeline to some of the most vulnerable people to the virus itself: older people, people with chronic illnesses, people who rely upon this home care workforce that is disproportionately Black and immigrant women for food, for their only connection to the outside world, for medication, for essential daily activities of living. And then home care workers continue to work without protective equipment, without access to testing or care or paid time off, and their children are home from school. So they have to figure out how they're going to take care of their own families, continue to provide the work that they do, and they take enormous pride in providing these essential services and helping to keep people safe in this moment, but they're doing so with no help whatsoever, no support, and we are having to fight to get them recognized as essential workers and to pass essential workers' rights. And we have been working with Senator Warren, Representative Ro Khanna, and many others to make sure that essential workers are included in relief efforts and in protections. They've created a framework for an essential workers' bill of rights that includes child independent care, paid family leave, includes hazard pay, right? Protective equipment, healthcare, testing, all of these things. Some of those provisions have made it into the HEROES Act, but we have such a long way to go to make sure that these workers who are keeping us safe can stay safe themselves and continue to care for their families. Now, the other side of that is this reveal of just how many workers have been invisible to us and undervalued, right? And insecure in our economy, but actually are essential. And so now the majority of this country sees just how many workers are essential and how much we need to do to ensure their safety. So I think that there's an opportunity here to reimagine how we care for all essential workers, especially care workers and domestic workers, and that can lead us to a reimagining of the care economy and the safety net that we need in this moment.
Yes, 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 yes. Just when I think about, as you mentioned, just the expectations that we have placed on our care workers, right? We really expect and demand their support to make sure that we can do the things that we need to do, but then we're not providing the support to them that they need. And specifically this, recognition in the form of payment and of protection and of benefits. You talked about the Essential Workers Bill of Rights, as one thing on the table that's come out of this. And so as we think about this moment, we think about trying to create a care economy that's equitable, as costs continue to rise for care and they take up a disproportionate share of Black and Brown women's incomes. And yet professional care workers continue to be some of the lowest paid workers, right? And not have access to these benefits or are left out of some of these labor laws. As we think about the disproportionate economic burden bared by women of color who are overrepresented in these jobs, in these positions, and who also have fewer resources to draw on due to intersecting gender and racial income and wealth gaps, and are still more likely to be sole or primary breadwinners in their families. How do we ensure that quality care is affordable and also ensure that financial security of care workers is protected, supported, and uplifted, right? How do we weave those two things together in order to create this equitable care economy, this equitable care system?
I think that the care economy is a place where women and women of color are at the forefront. And it is both in terms of family caregivers and their needs and in terms of the workforce. And if we prioritize, first and foremost, making care jobs, every last one of them, childcare, elder care, jobs, living wage jobs with benefits and real economic mobility, that is going to benefit women of color. And it is also how we get the country back to work again. That's the thing that people don't understand, is applying a racial and gender equity lens is actually about uplifting the entire country from the inside out. And that we call it building power from the margins until the margins disappear. If we actually support, lift up, add oxygen to the care and domestic workers who are organizing, who've been championing higher wages for care workers for years, and listening to their demands and give a seat at the table to this workforce, they will tell us exactly how to make these jobs good jobs with benefits and real economic security. And that in turn allows us to secure a workforce that then secures the rest of the American workforce and allows for this whole entire country to get back to work again, knowing that there's a strong care workforce underneath and supporting this entire economy to function again. At the same time, we have to understand that 70% of the entire workforce earns less than $50,000 per year. And Black women, women of color, families of color are disproportionately working in low-wage industries where they can barely make ends meet. So we have to raise wages, and we have to transform low-wage work, and we have to make care affordable and universally accessible to everyone, right? And that is going to require a massive public investment in our care economy. But the truth is that we're paying for care in enormously inefficient and ineffective ways already. The average family, as you mentioned, is paying out of pocket $9,000 for childcare, $60,000 for long-term care. And when you only make $50,000 a year, the numbers just don't add up. So I'm actually really tired of talking about the cost of care. I want to talk about the cost of not investing in care collectively. We think about care in this country, we have a culture in this country of thinking about care as an individual burden and responsibility, and that crushes people who are already structurally disadvantaged because of race and gender, right? it can't be an individual responsibility. It has to be a collective shared responsibility and a public policy priority for anyone who's serious about leading this country forward.
Mm-hmm. Yeah, and I'm so glad that you mentioned that. You know, I was thinking about what you said earlier about like our mothers and our grandmothers and the roles that they've played. You know, my grandmothers both were the matriarchs of our family. My paternal grandmother unfortunately passed 2 years ago, but before she died, she took care of my grandfather with Alzheimer's disease, you know, in the home until he passed. She took care of her mother, my great grandmother, in the home until she passed. My maternal grandmother right now is unfortunately not in great health. My mother has had to assume a caregiving role for her and has shifted to, you know, working remotely in her home in order to be there with her throughout the day, in order to make sure that she has what she needs, can help her with medications, basic hygiene, you know, getting food, all of the things. And so it's a deeply personal issue, right? The issue of care. And so the thing that you said about shifting this focus on, you know, care as sort of an individual burden or an individual responsibility to more of a collective approach. Can you say a little bit more about how we can do that? What does that kind of narrative shift look like?
I think it looks like calling for universal family care. I think it looks like calling for public investments in our care infrastructure, thinking about care as infrastructure. When we think about economic recovery, oftentimes the first thing policymakers will put in front of us is we've got to invest in infrastructure and shovel-ready jobs, and we think about the men in hard hats, usually white men, and really the true and first and most fundamental piece of infrastructure is our care infrastructure. It's our mothers and our grandmothers who've done this work with no support and no resources. It's the incredibly important care workforce that is holding us all up. And without a shoring up and an investment and the strengthening of that workforce, our economy will always be a house of cards. So investing in care as infrastructure, and it's not the same kind of infrastructure as other infrastructure because it's human beings. And it has to be human beings because the work that your grandmother did, the work that my mother does, I just personally recently lost my maternal grandmother, and she was supported by 2 incredible home care workers, hospice workers, and my mother, who was her full-time caregiver. And that work of keeping us whole and human at every stage of life is the most fundamental and important work in our economy, and we've never invested in it. And now is the time. Now is the time.
Thank you so much, Ai-jen, and my condolences to you. I know how hard it is to lose, you know, those women who have had such an impact and profound impact on our lives. And I really appreciate you just kind of humanizing us here at the end. Again, anytime we talk about these issues, we're talking about human beings. We're talking about human lives. We're talking about people being able to live with dignity. And so that's what these policy changes are all about. That's what racial justice is all about, right? Like that's the system we're trying to create, is one in which we value people and we treat people with respect and dignity, and we allow them to live in a way where they can survive and thrive. And, you know.
And just even to put a finer point on it, Black women and women of color have disproportionately borne the labor of caring for us as a country. I think we just need to sit with that for a second and understand what that means in this moment.
I agree. And it's also always been commodified. That expectation is that we've commodified the care that Black and brown women do. And so I thank you so much, Ai-jen, for joining me for this conversation and leaving us on that note with something really to think about and grapple with. I look forward to just continuing, you know, the work with you, the fight with you. And now I will just ask Julie and Jamie and Shauna to turn on your cameras for the next conversation. And again, thank you all.
Thank you, Dominique.
Thank you so much. Wow. Why did we agree to follow them? I'm Julie Cashin. I'm Senior Fellow at the Century Foundation and Director of Women's Economic Justice there. I also have the privilege and pleasure of working with IGN at the National Domestic Workers Alliance. And I'm really happy to be hosting our panel. With me is Jamie Calamarides from the Prudential Insurance Group and Shauna Bartley from the National Women's Law Center. And I'm really so happy to be here with both of you. Jamie, I'm just meeting. Shauna has been a partner in the work for a bit now. We've spent a bunch of this week together, and I just want to give a shout out for your strength and honesty and leadership and partnership in the way you've shown up this week. Thank you. Let me get us started with the next part of the conversation. And I just wanted to share a quote from Shirley Chisholm, the Black Congresswoman who ran for president in 1972, who said, "Laws will not eliminate prejudice from the hearts of human beings, but that is no reason to allow prejudice to continue to be enshrined in our laws, to perpetuate injustice through inaction." And as I think about this moment in time and the pain and the challenges, I think about how so much of US policy has been built on the hoarding of wealth and power. It's been built on racism and sexism and oppression and violence. And we can just see it so sadly and so clearly right now. You know, it's been discussed by Devon and IGN and Dominique, but we have a president right now who's leading with violence and toxic masculinity in response to protesters who are expressing outrage over the racism and violence of police officers that took the lives of George Floyd and Breonna Taylor and so many Black people before them. And as Devon talked about, that we're also seeing in the horrible loss of life because of COVID and the spread of the virus, that Black and brown people are being affected, are dying from the disease more often, and are impacted by both being essential workers and being those more likely to have lost their jobs. And so these are some of the outcomes that come from building our country's policies on oppression and violence and sexism and racism and ageism and ableism and xenophobia. And so it's in many ways feels super hopeless right now, but there is some hope too, right? And so we know that if we can create laws that are built on these prejudices, that we can also create laws that are built on something else. And if we think about what is that something else and what are our shared values, we can think about building something that's built on love and care and community and family, right? These values that we really do hold across, right? And equity as well. And so that's where we're going to start our conversation. And as we think about care and our umbrella of care and thinking about valuing care as a public good, I want to turn to Shauna and ask, why is specifically childcare so important for families and the economy, and what would make it successful? And please share anything else you want to share in that context.
Thanks, Julie. It's great to be in this space and having this conversation right now. My name is Shauna Bartley, and I'm the Director of Community Partnerships for Income Security and Childcare and Early Learning at the National Women's Law Center. I just want to thank you, Julie, thank Dominique and IGN for that powerful introductory conversation, and Devon for getting us started in what I think is the right thing to lean into in this moment, and it's to hold space to honor the lives lost due to the public health emergencies of COVID-19 and racist violence in this country. And as we've discussed, Black people in America have been disproportionately impacted by both. But I think what makes this conversation so important in this moment is that we recognize that our efforts to achieve racial and gender justice and shared liberation in this society must take a powerful look at the role of care work and how it undergirds our success to do that. We are talking a lot about the role that care work plays in our economy, and we're talking about the care economy, but we also need to name and hold space for the power that care work has in our movements. And when we look at all the demonstrations and folks calling for change in this country, we know that there are millions of women both participating physically in the streets, but also providing care and looking after others as we seek to realize a stronger society. And so just wanting to hold space for that. Childcare and other care work is essential because, as we're recognizing, it's the thread that ties communities together. We all have a relationship to care work because if we look at our lives and we look at childcare in particular, we were all children once. And so we all have some relationship to this issue. And what we've discussed prior is that care work has always been there, will continue to be there, because it's always been the work behind the workforce. It's always been there, whether caregivers have been compensated or not. And so when we look at the existing childcare system, the one that we have remains true to its roots that Dominique and Ijen discussed so wonderfully earlier. It's that we have a system where Black women and other women of color were enslaved and employed with low pay to get us to where we are now. And the system that we have looks at childcare as an individual responsibility built on historic and harmful notions about family composition, gender roles, and what constitutes work and paid labor. And what we are finding out now is that that's far from the reality of the overwhelming majority of American households. So quite frankly, COVID-19 is the proof point that no one wanted. It exposed many of the gaps in our existing fragile systems, but it brought something into very clear focus, and that is how deeply connected we all are. I am not a parent, but access to high quality childcare affects me. If children are loved and nurtured, that is important now for their healthy growth and development, and in the future when they become adults. Parenting and caregiving are not easy, and people need help and support now. And we have to think about, how can we come together as a community and support each other? How can we go about our days? How can we go back to work without childcare? What we've learned also is that a strong economy is powered by people and by working families in particular. And a strong childcare system is one that is responsive to this fact and built based on families' needs and wants. It provides equitable access to quality options. It's affordable. It respects the workforce by compensating them for the valuable work they do and supporting their growth and advancement in their careers. It acknowledges that childcare is a public good and pays for it accordingly. Quite frankly, we didn't have much of a system before the pandemic, but we have a real opportunity now to be forward thinking and create something that is much better and much more effective.
Thanks, Shauna. Yeah, I often say, we don't actually have any care system, right? That we just have a series of care arrangements. And so speaking of that, Jamie, I know you've done some writing about paid leave and the need for paid leave, especially in this moment. And was hoping you could tell us a little bit about what makes that important, especially from a business perspective, from a human perspective, and an economic one too.
Yeah. Julie, Shauna, thank you. And Shauna, thank you for your really important framing. I want to echo what both of you had started with, and that is to comment on today's environment. And Prudential, I am outraged at not only today's environment, but all the things that have caused it in the past. And Prudential and I stand shoulder to shoulder with our Black and Brown sisters and brothers in this time and in the future as well. And we publicly condemn all forms of systemic and individual racism and all of its causes. Our whole focus and mission as an organization is in our roots from 1875, and that is to help low and moderate income families achieve financial security. We started on life insurance, but we're also focused on a wide range of other financial security things. So I'm really here to talk about it as a practitioner on how do we deliver financial security to families at the times when they have their most desperate needs, the loss of a loved one, or the sickness or the illness of a worker, or when a worker has to step aside to take care of someone who's in their family, or the joy of welcoming a new child into their family and needing to take time to bond, but also making sure that they still have a paycheck as they're doing that. And Julie, you pointed out exactly as introducing to me that we haven't created a system. We've got a patchwork of solutions. And we have a system where it works for some and it doesn't work for others. For example, 47% of American workers have access to short-term disability or paid family leave. And in fact, the industry that I work in has paid out over $5 billion last year in income replacement paychecks to help people on maternity, paternity leave, on short-term disability when they're caring for themselves or when they're caring for others or on long-term disability. And so for the people who have access, they get coverage. But the people who don't have access are people who work in small businesses. And who works in small businesses? Predominantly women and predominantly people of color. So the system isn't working. And we've got to figure out a way to expand access to things like paid leave. And I propose, and we could talk about more, a public-private partnership. Take what works in the private sector and make it available to all. Make it available to folks that need it in small businesses, independent workers, entrepreneurs, people who aren't getting paid along the way. How do we give access to folks along the way? And that's, I'd like to talk more about that going forward too. How do we make the system work for everybody?
Thank you. I really appreciate that perspective and where Prudential is coming from. I kind of come to it. I think that there is absolutely a role for everyone to play. And I also think I worry that if we're not talking about, a public first system, right, where the national government, where we have something that builds on the Family Act or the Paid Leave Act, right, where we need a universal system that can get to everyone. So just, curious, to me, business has a really important role of saying, like, look, this works for us and this is what we need. Yeah, go ahead, I'll let you.
Yeah, it is the case for paid leave and caregiving for a human dignity, for moral reasons, for all the reasons we've talked about, is clear for the workers. What I think we need to do is get the employers to see the business case for this as well. And some might be convinced by the moral or the altruistic point of view, and some might be convinced by current events or by the catalyst of COVID, where they want to make sure that workers who are ill stay at home and come back when they're healthy, or workers who are staying at home taking care of sick people stay at home until that person's healthy, and then they come back as well, right? We need to continue and use this catalyst to grow it. But there's a business case for paid leave and caregiving, regardless of COVID and this environment. And that is financial wellness. We know and we can show that workers who are financially secure are happier, are more productive, take less leave because there's a correlation between health and wealth. And when they do have to take leave, they return to work faster. It is to employers, whether or not they're not-for-profits, governments, or for-profit organizations, it's employers' benefits to give people financial security, and specifically around paid leave, where there's a real gap. More than half of America doesn't have access to this. And we've got to figure out a way to allow small businesses to pool their purchasing power, to allow independent workers to pool their purchasing power in unions or in associations to get access to this. It's those areas that we need to develop as a group.
Thank you. And no, I really appreciate that. I think there are a lot of people who need to hear that this isn't just about what's right and what's moral, but it's also actually, you know, I think Ijin said this too, that there's this economic, you know, piece to it as well. Do you want to add something?
Oh, I was just going to say, it's how do we make this bipartisan and sustainable so that we don't get, when we get changes in administrations going forward, we don't get someone untying the infrastructure that we've built. How do we make this sustainable and ongoing? We've got a retirement infrastructure. It's not perfect by any stretch because it still doesn't cover everybody, but we've got in Social Security, it does, but in a workers-based retirement, we need to continue to expand it. But it's so much better than paid leave. How do we keep doing this for caregiving? And what I use paid leave as the financing side of caregiving. Caregiving is the essence. How do you allow someone to take the time to be a caregiver and still allow them to pay their bills and allow them, when they are done with their duty and their honor of caregiving, to be able to go back to their job and still be able to contribute that way for their family? I think that's the critical issue.
Thank you. You want to get in here?
Yeah, I really appreciate the points. And I do, what I've been sitting with a lot over the last few weeks is how a lot of our policy solutions, particularly those that emphasize some kind of bridge between a public option and privatizing most of this effort or tying it to employers and employment, is that those specific situations no longer stand up to the pandemic test, right? That like when an event of this magnitude occurs, that that when life as we know it is disrupted, those things that people need, resources, healthcare, we can't provide them. And so that's, I think, what is, as I said earlier, COVID-19 being the proof point we didn't want, but has been so powerful, is that we have to imagine and dream differently about what's needed to take care of each other so that people can go back to work, to jobs they love, so that they can provide care and take care of their households. But that at the core, our shared humanity and our ability to wake up every day and look out for each other and survive is tied more closely to one another than it is to our status as employees or as workers. And so how do we do that?
Yeah, I think right. And I would just add, like, I think this might be a little controversial, but I get excited when I think about these issues from the perspective of what's good for human beings, what's good for care and love and community. Because I think for too long, you know, I guess one of the things we've seen recently was a conversation about, you know, is the stock market more important than people's lives, right? That there was an actual, like, that was a conversation that people were having. And, you know, I think as long as that is on the table, it also has to be on the table that people's lives should be number one, you know, and especially Black lives, right? That should be number one. And then, you know, it's great that there's also an economic benefit and a business case. And like, let's start with the care case. Let's start with the human life case, and then work from there.
Yeah, Sean, you pointed out the fact that when someone gets separated from an employer, they still have to be able to have the safety net of these social contracts of making sure that people have access to healthcare, have access to unemployment insurance, have access to the means of sustaining their families. So it has to be a public-private partnership in so many ways, because there are times when you can't get it. The workplace is a great place to get benefits. It's efficient. It's you've got institutional buying power, so you can buy it in bulk. There's oversight. There's consumer protections within the regulations, but it's not the only way to get it. You have to be able to have a public safety net as well. because in this COVID environment, we've got 20% unemployment. So let's make sure we have a solution that also provides coverage there. It's absolutely critical. And it is, for me particularly, this is a social justice issue. This is a values and a moral and a human dignity issue. But we have to recognize there are other players in it too, these employers. And these employers are made up of humans with values, but they also need a business case to be able to respond to the capital that they're using. And it turns out these things aren't in conflict. We've got to educate folks more, folks on this call and others, that they're not in conflict, that we can find a win-win-win situation that focuses on the essential elements of the worker.
Thanks. I love the win for all framework, and I do believe in that for sure. And I think, while we're talking about that, one of the things that's happening is schools are closed, childcares are closed, right? My kindergartner is home and we're trying our best, right? Working full time and teaching him. And, as employers start to reopen, as it gets safer, right? And childcare is not open, or schools are not open, or camps are not open. Shauna, can you talk a little bit about what you're seeing and what we expect?
Yeah, I think, and I just appreciate Jamie's comments. I think there's something that's really coming and becoming clear, and that one of the comments made earlier was that just how we know that there's a business case for paid leave and for supporting caregiving. And I think that is the value of public-private partnership, is to look at what are the solutions that are possible. But I also think that there's always an opportunity to scale, and that we can't scale through private employers. We have to scale through public institutions and making sure that those public institutions are strong and able to do so. And I think when, that is the long-term goal, is like, how do we take what we've learned and bring it to scale? And I think in this moment, again, as we look at the pandemic test and what is working and what has failed, we're in a situation where it is not necessarily healthy and safe for children to return to school in the same way right away, right? It's not healthy and safe for children to return to childcare in the same way, but we know that both are still critically important to healthy growth and development for kids. It's important for families and for family support. And so when I think about what we're hearing and what's happening, it's like there's more questions than answers. And so how are we recognizing that this is a very unique situation where we have resources and tools to stay connected, like we're connecting right now from our respective homes, but that we also think about what we're doing to build and reopen. And I think that there's a lot of opportunity to think about the roles that employers can play in this moment. And one of the biggest things that we have to hold is that until boardrooms look like and include the workers and the communities they serve, the answers are not going to be there. And so this is a really important time for employers to listen to workers, learn from each other about what's needed and what's possible, and prioritize people's health and safety. We know that in the moment that we're in, we have to pay people living wages, and we have to give them supplies and benefits that prioritize their health and their economic security. And we have to make sure that we're not creating conditions that make people unsafe or put their families at risk. And one of the biggest things I think we can do right now is see employers join calls for strengthening childcare in this country through public investment. Public investments that prioritize quality, access, affordability, and advance racial and gender equity. And that's because what we had before this was an almost exclusively privatized market of childcare. And the small businesses, the childcare centers, the informal care networks of family, friend, and neighbor care, they were struggling to make ends meet and survive, and operating at razor-thin margins, and families were already paying too much. And so that system inherently was not going to work, and it's been decimated as discussed earlier, we saw over a third of the formal childcare workforce lose their jobs in April, and many of those jobs may not return because childcare based on financing does not work in a completely privatized market. And so there's an opportunity here to see employers really zero in on these challenges, listen to their workers, and work with us to really imagine and create a new system that works for people and centers the needs of kids and families.
Thank you, Shauna. And I'm just going to add on that it's not just children, right? That caring for our aging parents, for the daily activities of people with disabilities who need assistance and support, right? That we actually don't have a system for that either. And, you know, the baby boomers are getting older and we have no plan. And COVID has really shined a spotlight on that as well, because people in nursing homes or other congregate care settings have been hit by this virus, have died at much, much larger rates. And there's this interest in home and community-based care, and we have it as an option in our public systems right now, but it's not well supported, and the workforce is not well supported either. They're not good jobs. And it is majority, you know, Black women and immigrant women who are in these jobs. And so, you know, as we think about the need for paid family leave, the need for childcare, you know, the need for home and community-based care, and a real system to care for everyone in our lives across generations, I think it is going to take all of us. And I think we are going to need some really big asks and some big public investments. And we're going to need employers like you, Jamie, by our side, making the call for that. So we have a few minutes left, and I want to have you all give kind of a final thought, a quick final thought, and I'll close us out. So Jamie, do you want to go, and then Shauna?
Sure. First, I want to thank you, Julie, for hosting this panel, and Aspen of SP for putting this all together. And Shauna, thank you so much for your comments. I am so impressed and energized, and so excited to partner with all of you moving forward on advancing this agenda. I think my closing thoughts are: paid leave has a human dignity, a moral, a social business case already. We need to create a business case for the employer, and a private-public partnership can help advance, scale up what is already working for some and make it available to all, especially women and people of color in small businesses, independent workers, entrepreneurs. And it's got to be a private-public partnership, because there has to be a public safety net for those people that aren't affiliated with an employer or aren't working. And I think that when we think about these sorts of things, we need to think about it not just in the caregiving, which is the most important element. We need to think about it in the financial security, financial wellness realm, and we need to help people return to work once they've been caregivers as well, or once they're taking care of themselves. And with vocational and rehabilitation resources, and if we think about designing a system end to end, rather than just having a patchwork of systems, that's the way we can fulfill a vision of having financial security and paid leave and caregiving for all.
Thank you. John.
Thanks, Julie, and thanks, Jamie. I think this has been a really energizing conversation for me as well, and really helps me think about, you know, what are the stories and the ways we need to be talking about the value of care in our work and in our society. And I'm just still meditating on some of the wise words that Ijan shared with us about the caregiving being kind of the base of our society, the work that happens behind the work, and needing to honor the Black women who have historically provided and continue to do so, the immigrant women who come to this country to provide care and strengthen our communities, and the host of other women who are doing this work every day, balancing their careers, balancing other home responsibilities, and showing up And so how can we better show up for them? And recognizing that care is infrastructure. That's a conversation we have in partnership with NDWA often, with our friends at Caring Across Generations, and recognizing that we're in a moment where, as we move from thinking about COVID-19 relief, we're now thinking about what does recovery look like. And just like how care undergirded our economy before, it's going to be essential for our equitable economic recovery. And so what can we do as we think about money well spent, public money well spent? It's to support the work that keeps us healthy, keeps us whole, helps us work, helps us be more in community together. And so that is care work. And so our hope is to see much bigger public investments, like you said, Julie, and real deep thought about building stronger systems that center the women that do this work, that support their economic security, their professional growth and development, so that we'll all be okay, we'll all be well cared for. So I just want to thank you both for being in this conversation with me. Thank you, Aspen, for bringing us together. This has been really timely and really important.
Thank you. I'll just say one final thing, Devon. I see you coming on to close us out, which I appreciate. Thank you, Aspen, and thank you also to Jamie and Shauna. I think that's absolutely right, that we have a chance to rebuild right now, right? Things can't get much worse, maybe, hopefully. And so we can build from here, right? And we can build and lead with our values and lead, with care and love, and building a care economy that can undergird everything else. And I'm a little bit obsessed with Brittany Cooper's book, Eloquent Rage. And in it, she asks, what will it take to have a politics that puts Black women and girls, cis, trans, and everything in between at the center and keeps them safe? And I'm sure she would add, and I would add, and Black men and boys. And I think building a care economy is not all of it, but it will help. And it is part of the answer to that. And thank you all for facilitating this conversation today.
Wow, thank you so much to our speakers today, me, Julie, Shauna, Dominique, and Aijen. I especially love what Shauna said earlier. We have to imagine and dream differently about how we care for each other. That goes for our children, our spouses, parents, and even our own illnesses and disabilities. And as Aijen said candidly, I'm really tired of talking about the cost of care. I want to talk about the cost of not investing in a care infrastructure. So thank you guys for fostering a great conversation. Once again, I'd like to thank Citi for their support and partnership on this issue. Our report is available today to download, but we will also be sending it in a follow-up email. And this conversation today is just one in a series of digital events that the Financial Security Program has put on since March. Next week's conversation will be on emergency savings, same time, same place. I encourage you all to register. And thank you for listening, and please be safe. Thank you.
Thank you.